Yeah.
Good morning. Thank you for remembering swag.
Morning.
Thank you for remembering. I forgot. Mine is upstairs, I think. Um,
Oh, this is
I
just because I'm doing inspections this afternoon. I was like, what are you talking about? That makes
funny.
sense.
Um, I just made you co-host. If you can keep an eye on the waiting room in addition to me, that'll be helpful.
Yeah.
And I think this should be yeah, a reasonable, well, we'll see. I don't know. We'll see what this meeting will be. The work plan, I, I don't think I know we're not going to get through all of the slides on that, but I wanted to give them the material and give them an opportunity to kind of see the, amount of work that is with each of them and just see
Yeah.
we'll see what they pick up on, and then we'll use that presentation kind of as a marker and as something for folks to remind them of and bring back in for future meetings so that it's a common anchor point and not presenting it a new way every time kind of thing.
Yeah.
So
Sounds good.
Sounds more.
Yeah.
So yeah, just.
Okay. You want me to admit Jason here?
Okay, thanks.
With that. Forms. But
Shoot.
we need my today.
You've got some background noise, I think, Sam.
Okay.
Is it just because I'm moving around?
Oh, maybe it's not you, maybe. I don't know. No, I heard, people talking.
Oh, there are people talking.
Okay,
I'll stay muted when I'm not speaking.
okay. Jason sent me an email. Let's see if I can. Oh. Cool. Oh, yeah, I can change that. Good. Me. Was it a good day yesterday, Sam? Hey, Jason.
It was a pretty quiet day.
Yeah, good.
So good.
Good. How are you,
Hey,
Jason?
Jason.
I'm excellent, thank you. How are you guys?
Doing
Good.
all right. Doing all right. Thanks for your note, Jason, about the IMA and your message from Michael. I can change that. Yeah, it's funny because I did put select board for everybody and I thought, I don't know how many people, I'm making an assumption, but people will correct me. So yeah, I can fix that.
What kind of deadline are you guys on with this? Just
Yeah, so the absolute drop dead is, I think, the end of October. And when I say absolute drop dead, that's the, DPH will say, we can't give you any more money until you get this done. I, if we can do by the end of September, if we can get everybody through, I think that would be excellent. We have, let's see, Needham did Board of Health last week, and Tim just sent an email with a date for the select board, which I think is September 10th. I'm gonna go to Medfield on August 6th for their Board of Health, and Steve Resch was gonna work with the town administrator to get on the select board calendar. So, and I know you mentioned that there's no August meetings for the Board of Health. So is that the question of whether you need to call a meeting or whether you can wait?
well, so I the plan was to put a meeting together in the next couple of weeks. So
Okay,
we'll have it done by your deadline. So I wouldn't
okay.
should be all set in the next month, hopefully.
Okay, okay. And I have the presentation that I did for Needham that I'll do for no, not Dover, sorry. For Medfield, I will email that. I'll send that to everybody so that people can see what I talk about and then decide whether they want it for you know, whether you want me for either the select board meeting or for, the Board of Health, I will attend, whether you ask me to talk or not, I'll just attend just because I want to know. So,
All right, sorry to interrupt. It might be worth it if you can resend that agenda email to everyone because there was no calendar invite sent out. So I have a feeling people might have a hard time finding the link and that's why everyone's late.
there's, okay. I really don't like Microsoft 365. Sorry, going back to the old way. So there's a standing meeting invite that folks have in their calendar, and then the agenda email is sent earlier in the week. I don't add the, I don't add the, what do you call it? The agenda and Zoom link. Adding it to the standing invite is complicated because it's a standing invite. So I typically don't do that, but we can talk about communication. Mm. Um,
Hi, this is Daryl. I'll be back in just a moment. I want to grab something to drink.
Thanks, Daryl.
Normally people don't say that till after our meetings, but
Hi, Tim. I didn't see. Just, sorry. I Damn. Oh, okay. Everybody chill out for a second. Hey,
Can
hi
you hear
Kay,
me?
how are you?
Fine, can you hear me?
Yes.
Great. Did you do something on your end, Carrie, that made me able to unmute and turn on my video? I got a little message suggesting that you might have, but it wasn't clear to me.
Mhm. If I did, I didn't do it intentionally. Um, so we're just gathering, right? I had a couple requests for links. I just sent out a email to folks again. So Medfield is en route. I see Carol here already. And, yeah, we have a couple new staff. Let's just give folks a minute. I haven't been outside yet. Today I work remotely. The temperature said it was lower though. Is it cooler out there? Yeah.
Much cooler.
Driving, yeah. Driving home last night, it was 80 degrees when I left the building. It was 75 by when I got home. And it was wild it was like driving to the Cape, driving down towards the Cape. You could feel the temperature drop. It was really nice. So, morning, Steve.
Hi there. Hi.
How are you?
Good.
How are you?
Pretty good.
Okay, so I think, Daryl said she'd be right back. Carol's here. I don't know if Kathy's joining or not. I know Jessica is away. So I think we're pretty close. Unfortunately, we're not going to be a quorum today. Pardon me, Ed Cosgrove had a conflict. And despite efforts, unfortunately, the alternate has an all-day meeting. The alternate for meeting has an all-day meeting and wasn't available. So the only vote we had scheduled was to approve minutes. And we'll have to forego that until the next meeting. And I think, well, let me just wait for Daryl to come back. I don't want to get ahead of ourselves.
I'm back.
Hi, Daryl. Okay. So, so this is, this is technically not a meeting because we don't have a quorum. We are not subject to open meeting law until the intermunicipal agreement is fully executed. So that's good. Once the IMA is fully executed by all communities, both select board and board of health, we would, if we didn't have a quorum, I'd have to get an opinion, but we would likely have to cancel the meeting, because we wouldn't want to be conducting business outside of a proper meeting with a full quorum. So just a heads up on that. I think that will be something that we need to work through. Who are the alternates, making sure that they're going to be able to participate and represent fully. So that's one of the pluses of being a fully binding contractual arrangement. So, so I'll sort of call the meeting to order for purpose of the minutes. And I'll just do a roll call so we know who's here. And I'll start with Dover. I see two folks present from Dover. Can you just unmute and say who you are, please?
Kay Peterson, Board of Health Chair.
Jason Belmonte, Dover Health Director.
Thanks. And next is Medfield. I see three folks from Medfield. Can you just unmute and identify yourselves?
Yes, Steve Resch, Medfield Board of Health Chair.
Carol Reed, Medfield Board of Health alternate.
Brenda Ewing, public health nurse for Medfield.
And then for Needham, I see, for Needham, I see one person. Can you just unmute and identify yourself?
Good morning, Jen Casey, Needham, Mass. I'm working with, brand new, 2 weeks now, working for a training hub and shared services. Nice to meet everybody.
Thanks, Jen.
Tim McDonald, Director of Health and Human Services.
Great, thank you. And then other shared services folks, yeah. If you just unmute and identify.
Hi, Amy McInerney, the new Regional Health Inspector. Nice to see you all.
Sam. If you could just unmute and identify yourself for the minutes, please.
Morning, Sam Menard, Assistant Manager of the Charles River Health District.
And I'm Carrie Janelle, Manager for the Shared Services. And then last but not least, we have Sherborne.
Hey, Daryl Beardsley, Board of Health Chair.
Great. Nice to see everybody. Thank you all for coming. Carol, I see your hands up.
Yes, just a clarification. Thanks, Carrie. So you post the meeting and then I know you post it in Medfield because with schedules, we always want to make sure someone's here. It could be 2, could be 3. So you mentioned that because there's not a quorum, after the IMA, we might not be able to conduct a meeting according to open meeting law. Is that what I heard?
Yeah, and maybe, yes, so our quorum is all 4 communities. We have to have a representative, a designated voting representative from each community present in order to convene a meeting, open it, and conduct any business.
So even if we don't have a vote?
Correct. We need to post all of our meetings. They need to be, and then so Charles River, that would be me and our team. We're responsible for posting the meetings. Right now, we send a notice to each of the 4 communities asking them to post the agenda.
Yep.
And if any community thinks that they might have a quorum of their own Board of Health present, then they would need to post as well.
Yep.
And yeah.
So you all know in Medfield, we'll always have, like Kathy reached out to me, she can't join. Steve is our first, Kathy our second, I'm the next, and Brenda, as always, is dedicated. So we don't want to hold up the process. So I'm just trying to clarify, we'll always have at least one. And
Right.
that way, once the IMA is signed, business can be conducted, even though it's already posted. If we didn't have one, you're not allowed to have a meeting after the IMA is signed.
If we didn't show up, yep.
Thank
Yep.
you.
Yep.
But I don't count because I'm not a
Right.
voting member.
You definitely count, Brenda, but you do not count for a quorum. Yes.
I know, I just wanted to.
Everybody counts. And as I think we all know I think, the more folks that come, I think the better. It's great for sort of spreading awareness of what we're doing and as people are needed. But yes, it has to be a voting member present. So, okay. Are we clear on that? Any questions? Thank you for asking it, Carol. I think it's important to clarify this. Okay.
Are we allowed to have more than one associate member, just to increase the odds that each
Yes.
community will have somebody present? Okay.
Yep.
There's no limit on the number of associates.
The agreement's silent on that. Yeah.
Okay,
I
great.
think go ahead. Yes. Go
And
ahead.
one other
Daryl.
question.
Oh, yeah.
You said something, so up till now, you've been posting our meetings for us with our town clerks.
Yes.
Are you, I think you were implying that once the IMA is signed, that we will be responsible for posting our own meetings? Is that?
Oh, thank you for asking. Yeah, no, I didn't intend to say that. There's 2 pieces to it. So if you have shared services will always be responsible for posting the shared services meeting. Then the next layer is if any community is bringing a quorum of their own Board of Health,
Oh, I see.
then that needs to be posted. So we've talked about this a bit with Medfield, because they do have multiple folks, and we're in kind of a trial period, so it's been good. We've been able to work out some of this before we would suffer, real implications, I guess, of doing this. So So, you know, Medfield now is, I believe, in the practice of just going ahead and posting themselves as being in session for this meeting. So that if all three of them show up, there's no worry. Make sense?
Yeah.
So Kay, you all are in Dover, it's a board of three, correct?
That's right.
So if two members of the Board of Health were to join from Dover, if you recruited another partner, then Dover would need to post the meeting additionally.
Yep.
That's the best way I have to explain it.
And a staff member can be an associate member of the shared services.
Yes,
Okay.
it's, you know, every community is able to choose who they want for their voting members. That's a community decision, and you all would have that with your Board of Health, I think, and then report into us of how you, who you want to be your designees.
Great.
Great. Okay. Daryl, you had a question?
Okay, I didn't realize that about the, not just elected board members who vote.
I'm sorry,
so-
Daryl, your mic is I'm having a hard time hearing, Daryl.
Okay, I'll do that.
Oh,
Is
better.
this any better?
Yes,
right.
thank
Much
you.
better.
Okay. So last night we voted at the Sherborne Board of Health to sign the IMA. So I'll be signing on behalf of the Sherborne Board of Health, and I believe our select board is doing that.
Great.
And I also asked other board members, because all but one of us is working. So it's a little tough for some people to attend meetings during the day.
Mm-hmm.
I'm self-employed, so that means I get to work nights and weekends all the time. So
Right.
I can usually move my schedule around.
Right.
So I have that luxury, I guess, or curse. And one person expressed interest, Rebecca Honeywell, so we'll see,
Great.
you know, if we need an alternate too.
And that will be great. And I think what will happen is that then Sherburne would post there, if you and Rebecca were to both attend, then Sherburne would post your Board of Health. And I think the other piece that you'd have to.
Actually, we wouldn't. We're a board of 5 at the moment.
Oh,
so.
sorry. Oh, so you wouldn't have to. Okay. Okay. Good.
All right.
Okay.
Just wanted
Steve?
to update you.
Yeah, I think I think that I know when we were putting together the IMA, there was, I think, Carrie, you anticipated this challenge of getting a quorum and were concerned about it. And I think the communities basically wanted to stick with that idea of having a representative from every district. But that kind of puts the onus on us to make sure that, you know, we do everything we can to try and keep a quorum to these meetings. And I do think like the easiest strategy for that, it's obviously up to each community, but this easiest strategy is to sort of follow this model of having some alternates. And so I think that probably greatly increases our chance of not running into a quorum problem.
Right.
Yeah, over.
Great. Thank you. Yeah, and yes, and I think for us, you know, Ed Cosgrove has been a great for Needham. Ed Cosgrove has been a great and consistent participant. And Tim, if I'm right, Kathleen McCarthy was the alternate who was a regular attendee, but she left the board. She moved away.
Kathleen Ward Brown
Oh.
resigned from the board, and she still has her house in Needham, but her primary residence, she moved up to New Hampshire.
I
Got
see.
it.
So not being a primary resident, you can't be a voter, and not being a voter, you can't be a Board of Health member.
Right. Right. So, so yes, Needham has to just, we have to get sorted and make sure that this will be a good, that the alternate is able to make that, or if we need to find someone else for them. And, you know, happy to talk through specifics with any of the other towns if need be on that. Okay. Are we, everybody comfy on this one? Okay, great. So I want to make some introductions. As you heard when folks went round for the minutes, we have a couple of new staff members. I sent out a email letting you know, and I just want to point out and welcome them. Jen Casey, as I said, Jen has worked in the town of Needham in a few different roles for more than 15 years, and we're really happy to have her filling the role that Kristen Scoble had as administrative specialist. And I know Jen is gonna make sure that I keep all my promises, so you're all really happy she's here. She's a great addition. And then Amy McInerney is joining us as the regional health agent, and she will be out and about. I think she's already been out and about with Sam. You're doing some inspections and will be a resource for communities. And we look forward to a long relationship with both of these folks. They're great additions. We're real happy to have them. Sam, is there anything you want to add? What did I miss about either of them?
That they're delightful and we're so happy that they're here.
Yes. Yes. So Jen started on Monday the 8th and Amy started on Tuesday the 9th, and we have been working on onboarding them. It's been a little busy. The third week of the month is the busiest week for me at least, and sort of shared services in general. And we are coming up on fiscal year end reporting deadlines. So we're starting to move things around. So it's great timing for Jen to be here. And it's absolutely great timing for Amy because Sam has been fully certified as a trainer. And she and I have been meeting and talking about how to get that training schedule going. And Amy will be here just in time to be able to do some support for things that Sam might not have as much time for with the training demands. So yeah, so welcome to them both. And can't wait for you to get to know them. Carol.
Hi. Hi, Jen and Amy. Nice to see you. I have two questions for Carrie and Sam. Medfield Board of Health will be voting on the IMA. Our town attorney voted and is in Franklin as well, so we don't anticipate any issues. Adjacent to that, Amy and Sam are out and about, you had mentioned. Is there a way we know what the work is happening in each of our towns? It doesn't have to be micro, but what the opportunities are, what you're doing, so that we can support and cheerlead and thank the existing structure.
Great question. I'll do a couple things on there. So one way of knowing what the work is through our staff updates that'll happen in these meetings, and so that'll be recorded in the minutes. Then we also have started providing to each community a monthly report that we shared, that we contribute to in Needham. Since Needham is our employer, we have to contribute to that, and we're sharing that information with all 4 towns so that you can read it, you can include it in your own Board of Health meetings, you can call us and ask questions about it. And that is, a general monthly summary of activity. And then there's the work plan, which I have on our agenda for after our presentation from BME, so 10:30. So there's very specific assignments in the work plan, and those will be parceled out to different folks. So those are 3 ways.
So I understand reporting. I'm not looking for extras. I'm just wondering, I guess what you're saying as part of your programmatic or activity report, there's going to be Medfield 3 inspections, or is so that we know what work is being collaborated on or done in each of our town. That's really, I'm not looking for your accountability. It's more about understanding the action and supporting and applauding.
Go ahead, Sam.
Yeah, Carol, I have a detailed log I keep monthly for like every individual inspection or activity our team is doing. What makes it into that monthly report is a bit more general, because I think when we first started, I was like adding up numbers. There's a lot we try to fit into that report. If you wanted those numbers, we can get them to you, but I think it's just general statements now. In the monthly report about, you know, we're helping with food, pool, whatever other inspections for these towns this month. But I do have detailed records of all individual inspections if you really wanted them. But if not, it'll be more general statements in that monthly report, which I think I had sent out last week. And now I am putting the Charles River logo on it, and sending that out to the advisory board every month.
Great. So what I heard you say is what you already do, we can look at, and we will see the time you spent in each of our towns through your detailed own thing you already make.
Yeah, if we did, because honestly, there's some months where we're not doing activities in every town because it's on a request basis. So it fluctuates monthly, but you'll see which towns we did which work in on the monthly reports.
On a request basis is great. Thank you.
So I'm not sure actually. I'm going to ask. So the monthly report is going to include the information of where we've been. If you wanted a list of which establishments were inspected on which date, that is the by request.
We can talk offline. What we want to know and support is understanding what Sam and Amy, and in the future a nurse, do as far as time and partnering with our existing structure. I know all about having to report minutia, whatever is easy if you know, and we can talk offline. We just want to make the connection. I do, to be grateful and communicate that to our select board and be able to let people know quantifiably what tangible things are available and happening through the commitment of this grant.
So, and I think, Carol, it's a two-piece thing. And I see two hands, but, and I will get to you, but I just want, it's a two-piece thing because the work of the grant is detailed in the work plan, and that is not solely inspections conducted in other communities. There's a lot of things that we have to do collectively that are also there. So it's not so much minutia that we're reporting, actually. It is the reports that we do are intended to be substantive and provide information. So Brenda, I saw your hand up first and then Kay.
I think that's a lot of what we report, and I may be wrong, Carol, in our monthly board meetings, because I know Carol very eloquently asked about using these shared services, but not everyone wants to or has the need to. So we don't want it to kind of look like Medfield's not using them. Right now, that person is choosing not to use them. How do we differentiate that?
I mean, we certainly could, and I've said, and when we talked about the monthly report last month, folks were pleased with what it looked like, asked for the addition of the logo. And I said then, if there's changes, if there are additional things that folks would like to see in that report, we're happy to do it. We just need to hear about it.
I think
We're
what I'm
not structured
saying-
right now to say
Right.
Dover, 3 inspections, Medfield, 0,
Okay,
Sherborne, 2, whatever, 0, Needham, 0. We can, if
No, but I don't
if the
want
body would like
people-
that.
I don't want people in our communities to think that you're not, someone not in this meeting or in public health doesn't understand that all we have to do is pick up the phone and ask, or send an email to Sam or you. I don't want that to come across that we're not using the services.
I
We're
think
not u-
in
You know what I mean?
if you guys like, I think an easy solution to that is I could just put a general statement in the monthly report after I say what sort of inspections we conducted, is that these were inspected on a request basis. That could just be a general statement in there, if that would be helpful.
I'm done. I just want to
Okay.
make sure that we know you are doing what we ask.
Okay. I'm gonna go to Kay. You've been waiting patiently, and then I'll come back to you, Carol.
Why don't you go to Carol, because I'm still thinking about what my question is.
Okay.
In a nutshell, Carrie, you kindly came, presented to our select board. Diana presented to our select board. Back when our town administrator manager signed on to this, kindness of Tim, through Denise Garlick, we understand through all this time, it's not funds given, it's enhancing the service capacity in our community through existing, through the staff you build and the work plan you build. So how we speak about this is we're grateful to be a part of Charles River, because through the staff you have, our services will be enhanced. Is that accurate? Like, people ask us, can we buy this? Can we buy that? Like you presented, this is not about giving Medfield money.
Mhm.
This is about Medfield being able to enhance the services to their residents, environmental inspections and public health nursing.
Mhm.
Therefore, we want to continue to communicate now that your staffing is increasing and available and the IMA is going to be signed through the work plan, what is available, and when in fact your great staff are in our town, whether it's 1 day or 4 days or no days. Because my role as a 34-year resident and a Board of Health member is to advocate for connection to the great structure of this grant.
Okay, yeah, and I think, again, I think that work plan presentation that I sent you very late last night, I admit, includes that. And I think maybe, as Sam said, including some of the statements in the report, the monthly report, or maybe we create a header that just kind of clarifies what it is, and that how it works, because I have that slide of what can shared services do for you and what and how does it work. There are 2 slides on that, and we can pull some language from that and make sure it's included in the monthly report. And that maybe will get us there. And yeah, okay. Okay.
So maybe this is more of a question for Carol, but are you saying that you feel a need to communicate with your select board about the nitty-gritty details of what shared services is doing in Medfield? And do you feel the need for that on an ongoing basis, or one option would be to do a snapshot to say, the month of June, in the month of June, as an example, shared services supported Medfield in the following ways. Those kinds of reports with that much granular detail are time consuming and take resources from other things. And the question is how important, I could imagine that it was certain select boards that it could be very important to provide really granular detail to justify the relationship. But the question I have is, how important is it? And is it important every month? I don't, my sense is that I maybe regret these words, but that in Dover, that's not an issue, and that we just need that a sort of general report, even if that is what we need. But I'm not sure I understand your need in Medfield.
Steve.
Yeah, I mean, I know where Carol's coming from, like, is always trying to advocate for greater that Medfield should really maximize the level at which it's taking advantage of the opportunity to participate in the shared services. And probably our structure in Medfield has, but in any case, I think we're past we're past the point of needing to sort of justify to the select board. I don't think that's a high risk at this point. I mean, I think they're bought in, but it is true that at some, it's always nice, and at some point, but certainly not on a monthly basis, but at some point, it almost really like on an annual basis, like, or when we come to try and re-up or continue participation in shared services, that we're able to point to some ways that Medfield benefits, and if it's the case that shared services staff are providing services that in the town of Medfield, obviously the extent to which that is happening, if it does end up happening, is a great piece of evidence that for us. But I don't think it's something we need to track monthly or make a big burden. But there are points in the process where it's nice to have a picture and be able to say, like, and the other part of it is, I think maybe, Carol, I don't know, is like, maybe is to be able, it's also good for the sort of Board of Health to have a sense, not so much because we need to make a case or because there's a risk of not participating, but it's also good for us to know, like, how we are or aren't taking advantage, so that if there are missed opportunities, we can try and nudge or intervene and so forth locally to take better advantage. Over. I don't know if Carol,
So you've all been kind. At the age and stage I'm at, our town is very slow to meet with Sam and Carrie to start to uptake the services. I'm all about transparency. So we will sign the IMA. Steve will as the chair. The select board, I'm confident, will. And that is the time to start to advocate as volunteer community members to take part in the work plan and structure that shared services has set up.
Yeah.
But up until this time, there has not been collaboration The end.
And yeah, I think every, so we are forming a collaborative, and we are, you're building trusting relationships among the communities. There's some work done of, building trust with, from you with me and vice versa. And I think every community is moving at a different pace on it. And yeah, I understand what you're saying, Carol. Structurally, there's a different kind of relationship that I think contributes to it, because Medfield has a contractor that provides their inspection services, and that is different. It's a different kind of setup than other communities where there is where there's inspection staff, and they are staff. So there's different direction. And yeah, I think that certainly that structural piece is another factor. So, yeah, and this has been helpful, kind of listening to the questions and the thoughts and thinking about, what could we do differently in the reporting that makes us accountable to you, that kind of shares the info for you of how often are, as you said, Carol, how often are we in each community? And that's in addition to the other work that we have to do to elevate services for everyone. So there'll be instances where, Sam or I or Amy is going to be in town, and we're going to be doing some things on trying to catalog training needs. And then we'll develop a training plan and make sure that everybody's kind of on board and has what they need to get there. There's a variety of things in the work plan that will benefit the communities that are not direct inspection points, right? So I want to try and figure out how we capture all of it. And Sam and I were having a conversation about this similar, earlier this month. So, it really is helpful to hear from you all. So what I heard is, the value of a picture of what is happening in each community, at some interval. I think we're going to add some more information into our monthly report that talks about how shared services, inspections and the like can be accessed. And I'm going to talk with Sam. We'll see what we can produce. Maybe we can do quarterly, when we're doing our quarterly reporting, we can draw on that log as an additional piece that goes in to DPH and is shared with you all. Did I do a reasonable job capturing what people said? Yeah. Okay, great. Thank you. Well, let's see. Daryl, yeah.
All right, so as part of that, I think I'll give some advance warning to the shared services about what Sherborne has been talking about as a future need. Maybe not so far off in the distance, and I know that Sam and I think Amy was out in the field looking at soil test pits in our town. So what we're hoping for some of the more difficult or contentious projects is to have shared services folks be able to be a neutral third party for some of the evaluations. We've never, in the almost 40 years prior, ever had disagreements out in the field, but we did recently. So we're just thinking that's going to be something that we're going to look to shared services for. So
Right.
Yeah, what I can say to that is absolutely. I am technically a certified soil evaluator now, but I mean, I'm very new to the game. So any opportunity anyone has where Amy and I can get more experience in the field would be so appreciated and put us one step closer, to being at that level. To be independent evaluators, and I am already harassing Nui Pick to get Amy signed up for the soil evaluator class in the fall. So we are rapidly moving towards being able to provide that service to you all.
Yeah, that's
Yeah.
great. And Mark's enjoyed having your company out there, and
He's so
you got to
wonderful
meet
too.
one of our
He's
best engineers too, who I think was there when you were out there.
They
that
were
day.
all wonderful and just giving us a whole classroom session along with Jessica. I think we can all say we learned so much from them when we were out there. So it was so appreciated.
Good.
Same on this side. And again, I just wanted to make sure you knew that we've got plans for you.
I love that. Keep coming up with the plans.
And yeah, I love it too, because, and I think it's a nice point of, it's not just about numbers, which I think we're all kind of saying generally. It's about, there's some qualitative aspect to this. There's the additional resource for, are we interpreting this right? There's the, how do I get some assistance from the state? There's that reach back. And that's absolutely what, we can provide in addition to, manpower, or sorry, person power for inspection, sorry. So yeah, I think that'll be important to try and capture, that, supporting on complex soil evaluation cases in Sherborne, and that might not take up, might not have as many numbers as for inspections, but it's of value, right? And that's part of it too, is that what is of value to each community is going to be different, based on where you have strengths, where you have gaps, where you, have new things coming in that everybody's going to be different. So, okay. Great conversation. All right. And now I am going to introduce, so thank you, Janice and Rebecca. It's nice to see you both. So on our agenda for 9:45, we had the fee and cost study presentation from BME Associates. And we have two folks here from BME to represent. I'm gonna ask them to introduce themselves, and would you like to, shall I give you share screen service? Okay. Does it matter which one I give it to?
Could you give it to Janice, Carrie?
I will.
Thank
Okay,
you.
so I'll do that while you all introduce. Thanks.
Yeah. I'll start. Hi, good morning, everyone. Rebecca Hana. I had a chance to meet you all last kickoff meeting, which happened in April, and we're really excited to present the preliminary results that have come to date. And Janice has been really working hard to do that analysis, so she'll be leading today's presentation. Go ahead, Janice, do you want to introduce yourself?
Absolutely. Hi, everybody. My name is Janice. I just wanted to see if everybody could see my screen. Thumbs up. Awesome. And everybody can hear me okay? Awesome. My name is Janice. I'm the Associate Public Health Consultant for BME Strategies. And today I'll be providing a progress update on the Charles River Public Health District Fee Analysis Project. And we're going to dive right into it. So diving right into our agenda for our fee analysis project overview, we're going to go into a quick project overview, and then we're going to go talk about the phase 1 preliminary fee cost analysis and results. We'll go into next steps in which is phase 2. And then if you could all save your questions for the very end, we'll have some time for discussion as well. Really quickly, we'll talk about the Charles River Health District Fee Project overview. We've split it up into 2 phases. Phase 1 is the preliminary fee cost analysis, which we will talk about later in this presentation. And the objective of that phase was to compare the fee schedules of the communities in the Charles River Public Health District. And phase 2 includes data collection and stakeholder discussions, which we'll discuss later on in the presentation, with the objective to assess fees against the labor time and other associated costs required to provide their permit services. I want to really quickly talk about the final deliverables at the end of this project, with first being the permit fee calculators for each of the Charles River Public Health Districts, district municipalities. Second, a standard operating procedure for calculator utilization. And third, we'll have a brief final report with recommendations, including 11 points for fee schedule analysis. Now I'll talk a little about the protocol and the results of our phase 1 preliminary fee cost analysis. And we first started phase 1 by conducting an initial review of the fee schedules of the municipalities of the Charles River Public Health District. We then split fees into 3 major categories: septic, food, and miscellaneous. We grouped similar fees of those categories for comparison and generated summary statistics from those, that including average and standard deviation. And then to add another layer of complexity to our analysis, we decided to compare the fee schedules of the Charles River Public Health District municipalities to like municipalities. From our initial review of the fee schedules, we found that the latest dates on each of the fee schedules was of the following. For Dover, it was the fees revised in November 2023, Medfield, the septic engineers revised in November 2012, and the current food establishment fee schedule replaces the previous from January 1998. For Needham, the fees were effective July 2023, and for Sherburne, the fees were amended April 2012. We want to provide an example from each of the categories of the fee comparisons in the next slide. First, we'll start off with how many fees were able to be compared. We were able to compare 24 permit fees among the Charles River Health District municipalities, with the caveat that many fees could not be compared because there were no similar fees in other municipalities. First, we'll start out with septic. Here we have a table. On the vertical columns, we have the 4 municipalities: Dover, Medfield, Needham, and Sherburne. And on the rows, the first row, we have the least expensive septic fee and then the most expensive septic fee. For Dover, the least expensive was the septic hauler permit and the most expensive was soil testing. For Medfield, the least expensive was application for transfer or renewal of septic license permit, and the most expensive was the first septic permit application and plan review. For Needham, the least expensive was a septic system variance request, and the most expensive was the soil application. For Sherburne, the least expensive was the transfer of the septic permit, and the most expensive was the soil testing. Of the 4 municipalities, soil testing was the most expensive in 3 out of the 4, and there were still variations in those soil testing costs. In terms of food, we have the same table oriented in the same way, just with the food fees that were able to be compared among the 4 municipalities. Here we see that food establishments were the most expensive fees, and we see that the larger the restaurant or the greater the capacity of the restaurant, the more expensive the permit fee was. In terms of miscellaneous, this was the category with the permit fees that could not be categorized as either food or septic fees. And so here we put it into this category for everything else that could not be categorized in the other 2. We wanted to give a very specific example of a fee and what the analysis would look like. So to orient you, we gave an example of the septic installer's permit. Here on the top table, we have the columns of municipality in the first column, latest date on septic fee schedules in the second, then municipality specific permit name for all of the municipalities, and then we also have the municipality specific fee. In the second table, the table below the first one, we have the summary statistics, and we see that there's a minimum fee of all 4 of $150 that's associated with Medfield and Sherburne, and a maximum fee of $250 that's associated with Needham. We have an average Charles River Health District fee of $193.75 with a standard deviation of $51.54. We also wanted to provide an example of the fee with the biggest difference, and in this case, the biggest standard deviations of the ones that we could compare. Here, it's the tobacco permit, and we see that the minimum fee here is $200, with the maximum fee being $700. The average was $400, with a standard deviation of $264.58. which is the greatest of all the fees that could be compared, the greatest standard deviation that we saw there. We wanted to add an additional layer of complexity to our preliminary phase 1 analysis. And we wanted to compare the fee schedules of the municipalities of Charles River Public Health District to like municipalities. And so to identify those like municipalities, we used the state's Office of Rural Health's definitions of rurality, MAPC's community type groupings, and similar census demographics. And we're going to provide an example right now. So similarly, we're doing the septic installer's permit, which we saw a couple slides above before for the municipalities of Charles River Public Health District, which is above the dark blue line here. Below the dark blue line are the like municipalities of the ones that we've identified. For Sharon, that's the like municipality for Medfield. Stowe or Neshoba and Walpole are the like municipalities for Dover and Sherborne, and Wellesley is the like municipality for Needham. And we see it's set up in a similar way with municipality, latest date, municipality-specific permit names, and municipality-specific fee. We were also able to generate summary statistics for the septic installer permits for those groupings. In the first column, we have those summary statistics that we saw just among the Charles River Health District. Then we have the Charles River Health District plus Wellesley, Dover, Sherborne, and Stowe, Dover, Sherborne, and Walpole, Medfield and Sharon, and finally Needham and Wellesley. Here we have a table of orienting you with the 4 like municipalities. And we also wanted to generate a table with all 4 of those groupings, and then the biggest difference of the permits and the smallest difference. Here, the difference we are associating with the biggest standard deviation amongst those groupings and the smallest standard deviation amongst those groupings. I'll give a minute or so for this slide, but I wanted to say that this slide concludes our summary of the phase 1 results. And at this time, I'll pause for a couple of minutes for any reactions before going on to phase 2. If needed, I also have the entire analysis results in a separate spreadsheet that I can pull up and if anybody has any questions. Good.
I'm still trying to digest, but I like seeing the numbers. I have to from Sherborne, so it does help see what the different costs are, especially for like activities. Like I'm thinking about like the kind of the highest fee and lowest fee. I haven't wrapped my head around that because the activity is so different for any of those things that, you know, it makes sense to me why one is higher and lower. So I'm not sure it bounds the issue, but the comparison across municipalities is very helpful. I'm glad that you went beyond just our 4 towns, because what we've done in the past, like we haven't updated our fees in a long time because it's always fallen on the board to have to go out and research what other towns are charging for things, because that makes stuff more defensible for us when we go before advisory in our town. Financial groups, you know, monitor how things are being done and try and balance between not seeming out of line with surrounding communities. So that is really helpful, because it's nearly impossible for us to fully evaluate what it costs us to provide the services, but we know we are underbilling for sure. But every project is so variable. So to pick one fee without having the burden of like tracking every minute that's spent with somebody and relaying that aspect to them in time for them to adjust how they deal with us. You know, there are food establishments who are on top of things, and there are others who rely on our inspections to educate them about what they should be doing, which is not the right way to go about it. So we also need some other
Absolutely.
mechanism built in there for getting them more on track for their responsibilities. So anyway, in general, so far, I can already see things that we can use, so I look forward to phase 2.
Thank you for sharing. Yeah. Steven, did you have, I see your hand raised.
Yeah, no, this is great, a great resource. I think I guess my quick reaction is sort of that in some ways the slide that is most interesting to me is the one where you gave one example of basically the exact same service and how it differed across. I think it was a septic thing. And you know, because this sort of the slides where you're showing sort of the biggest difference and the smallest differences is useful in the standard deviation. But I guess part of it is figuring out, you know, I mean, yeah, this one is sort of like I'd be curious to see. This is the kind of thing that where I'd be curious to see that for for any given fee, septic installer permit being one, but just replace that with whatever the fee is, as many of these tables. And if you've done this, that also includes those 4 other comparator towns, you know, all the better. And, you know, I don't know what the theory is as to why if there's an explanation of why, yeah, I'd be tempted to sort of lump it all together in the sense that I mean, I guess there are some arguments to be made as to why it might be a higher fee charged in one town or the other, but you know, basically it's the same work for some, you know, for maybe it's not, but you know, but I would think like they're all comparable in a sense to me. Like I don't know if we have to partition them so much. It's just, you know, I like almost seeing the aggregate, you know, seeing all the 8 towns you have for a particular fee. I think that's the most useful. Or that's my initial reaction anyway. Over.
Yeah, absolutely. So we actually have a separate spreadsheet with all, so first we'll have all of the ones just within Charles River Public Health District that can be compared. And then I also have a tab. All of this will be sent to you. Have a tab with the Charles River Health District and the like municipalities too. So we'll have all the information listed out in a spreadsheet in a similar format that we have on the slide. This is just one of the examples that we were able to compare.
Just one more question I had was on you in across these slides, you've basically had the permit name, which has slight variations from town to town. Like I remember on the tobacco one, some of them say tobacco sales permit, and then some of them didn't have the word sales in it. I'm not quite sure why we don't have a tobacco permit fee, but setting that aside, is your evaluation that these are basically permits for the same thing? They're the same thing, even if they have slight variations in their name, right?
Yes.
Okay.
Yes. So there's slight variation. So what we see with the top blue, that's the tobacco permit. And so that's sort of our method for comparing the fees. If they're slightly different, but along the same lines, we were grouping those fees together for comparison. And so
Okay.
that's our protocol for comparing the fees.
Thank you.
Perfect. Thank you so much. Hi, Sam.
Hey, I just wanted to add in there because Carrie and I have been seeing a bit behind the scenes on this process. I think a lot of Medfield's fees were not posted on your website, which is the main area I think BME was drawing from just for these first numbers. I think you'll see later on in the presentation, a part of next steps, they're gonna dive deeper and try to get all those missing fees filled in. So that's why Medfield, you'll see a lot of NAs right now. It's just because they weren't available on your website.
Yeah, because Nancy Benatti should be able to give you numbers for any one of those that are missing. She should be able to supply. So yeah, over. And I'd add that if you needed the Board of Health's assistance on that, just let us know.
Absolutely, we can definitely add those in. Hello, hi Kay.
Hi, my question is, I think, really down the same path that Steve's was. It's the apples and oranges question, and there's that saying that if you've seen one Board of Health, if you've seen one Board of Health, you've seen one Board of Health, and that it's very hard to compare. But I really think this study is helpful in allowing us to compare, even though we can't be certain that every permit you've described in this is exactly the same in each municipality. At least we're in the ballpark with that. I do think the one question I have is around soil testing and whether we've talked in some of our board meetings, and I think I've heard Sherburne has done this too, that some applications require much more work than others. Maybe this is an issue for septic applications as well as for soil testing fees. But and I'm interested in, I wonder if there's a way for you to drill down, no pun intended, into what goes into some of these permits and how the various municipalities deal with that. For instance, Jason maybe could help me, but we've talked about a strategy for charging more for some of the, a way to amend the fee process to compensate us for some of the what you could consider outrageous amount of work for one application. And I don't mean to criticize anybody. This is in part a reflection of the fact that the available land in Dover for development is usually very challenging and requires a lot more evaluation than it used to, because all that's left is really very limited in its prospects for development. So I'd be interested in how other people think about that question, and how we could address it. And also, would that be interesting for other municipalities in our group?
I think that would be very interesting. Sorry, dear.
Yeah, if I may, I think some of these questions could be answered by our phase 2 process. So would it be okay to move on to the description of phase 2, and then I think we could revisit maybe some of the great feedback we're getting. So, thank you.
Yeah, I echo Rebecca. I'm going to move on to our next steps, and hopefully we'll address some of the feedback and the comments that we've been getting. So moving on to phase 2 of this Charles River Health District fee analysis project, which really involves data collection and stakeholder discussions. So the objective of phase 2 is to assess the fees against the labor time and other associated costs required to provide permit services. And so our proposed approach is to gather and input identified resources into an existing MHOA permit fee calculator for Charles River Health District use. How we'll do this? First, we'll collect data before some facilitating working sessions, and then will do facilitated sessions with key stakeholders to gather inputs on permit-related administrative and inspection time. We want to give a little bit about of an overview of the MHOA permit fee calculator. It was developed by the MHOA for local public health departments in Massachusetts to set permit fees, with the purpose of the calculator being that permit fees should be based on actual costs associated with the local public health departments to provide that service. And the fee schedules should definitely be defensible and not arbitrary. It's already built into the calculator that it costs for a 5-year time period. So involved within the calculator, there's already a recommendation that we would revisit costs every 5 years. Here's a screen grab of a portion of the MHOA permit fee calculator. Every column that you see in white is either inputted or calculated from the highlighted columns. The highlighted columns of hourly rate, which is in light blue, is an admin time and inspection time in light yellow, requires specific data inputs that will gather pre-facilitated sessions and during facilitated sessions. The required data inputs for the permit fee calculator, so in order to calculate the hourly rate ahead of the anticipated facilitated sessions, we would need these provided inputs on the left side of the screen. We'll need to gather the time inputs during facilitated sessions, such as administrative time for permits and plan reviews and inspector time for permits and plan review. Last meeting, we started the conversation of doing more in-depth data collection with the municipalities. So now that we have identified the tool that we will be using, the MHOA permit fee calculator, we are really starting discussions on piloting it with Needham. And this will give us an estimate of the staff time that's required to fully customize and complete the customization of that permit fee calculator tool. So there's an opportunity for Dover, Sherburne, and Medfield to simultaneously pilot the tool, or if preferable, we can estimate the staff time, the tool, based on the Needham pilot, and then report back to the rest of the Charles River Public Health District. So given what we presented so far in phase 2, BME wants to pose a question for discussion, like do any of the other municipalities want us to start the process of tool customization as well?
I think
Thank you, Janice. I'm just, oh, sorry, Rebecca, go ahead. You go and then I'll, yeah.
I was just going to say, we certainly can answer any questions about the calculator itself. I know it maybe it hasn't gone in front of everybody before, and so I'm happy to provide more of the mechanics of how the tool works.
Thank you, Rebecca, and thank you, Janice. I just want to take a second and go back to sort of how we framed this project initially, and in our discussion with the advisory board about this, there was some concern about available staff time to contribute to it, and so we came to an agreement that we would use Needham as the first pass and give folks an opportunity to look at some of the results and think about it, and then come back. So that's exactly what Janice and Rebecca have brought us to. And you know, I don't think anybody has created more staff time, but maybe now seeing some of the results, this should be a good conversation. Thanks.
Daryl?
Okay. Right. I was nervous about how difficult it would be to try to put time on something that is so incredibly variable depending on applicants and others who need our services. But as a way to, and I get the idea for having justification for what fees we were thinking of defaulting to what's a norm out there that's somehow been arrived at by a lot of municipalities. So that end is still helpful. What I would, on the calculator, sheet, you have the columns for the time estimate. I think
Mhm.
it could be valuable to also include, you know, maybe an average time, a low-end time, and a wild high-end time, because we get some, there are just those handful of things where the amount of time is extraordinary.
Mhm.
And not because the projects are very different, there could just be other factors, timing of how the material comes in, people's willingness to follow the process steps, yes or no. And that would help illustrate where there's the big variability, and make it a little easier on the staff who are trying to figure out how do they come up with an average in their head for things that are so different, essentially.
Yes. Thank you so much. We've definitely noted that recommendation for sure. Hi, Timothy. Oh,
Hi. So thank you for this. I think it was helpful to see, and specifically, one of the things that I noticed going through the first part of your presentation was Needham's, tobacco permit seems like an extreme outlier in terms of cost compared to other communities, or cost of sort of any type of permit. So part of the reason I'm really interested in this is, is that because we do diligent quarterly compliance checks that involve 1 or 2 underage youth plus a police officer and a health agent? Or is it because we don't like tobacco and think it's bad and we want to, charge people more so they, there's less tobacco potentially? The former would be great. The latter is probably the type of thing that we used to do and hopefully are trying to not do in the future. So I really appreciate the opportunity to look at this and try to see if our fees are really based on, approximately what it takes to do the work or not. So.
thank you for sharing. Any other questions, comments, concerns?
I will, just really what's driving the calculated permit fee is this hourly rate. So that's the overhead that goes in, the other expenditures that are associated with with providing the service. And so we would want to get a good hourly rate estimates based off of those data inputs that Jan is shown on the next slide. And then during the facilitated working meetings, it would be to capture the min, max, the average admin time, and the inspection times.
Yep, absolutely.
And I assume you'd like hourly rate that's loaded with the benefits portion as well, not just.
Yes. So the hourly rate has all of these inputs that are necessary to actually calculate that hourly rate for every activity involved with permitting. So these inputs are going to be required to calculate that hourly rate.
And see, Stephen has a hand up.
Yeah, you had asked a question about starting this work in Needham, or also the other involving the other towns, and I don't know the back story on that as far as like whether there was whether it's too onerous for the other towns to participate or something. I don't know, but I guess my question was, are we talking about doing this sequentially with Needham first, or is and then the other towns, or and we're being asked to decide on doing that versus all of them together simultaneously? I was a little unclear about that.
Yeah, so we wanted to pose that question to really get the reactions. There's a possibility to do both. So either one, we do pilot all of them simultaneously, some of them simultaneously at the same time, around the same time, depending on people's schedules, or we pilot it with Needham, come back with the staff time that's required to put in that data and report back to Charles River Public Health District.
I
So
see.
we really
So
want to
you
get,
get,
yes.
so you're saying you're going to get an idea of how much effort it takes to collect this information by doing it in Needham, who's willing to do it. And then you can tell the other towns, you know, this is really what this is our ask of you is going to take this, you know, this much time. And to sort of encourage participation or not, or help the towns evaluate what level they want to participate in it, I guess. Okay. That makes sense. I mean, I don't feel I don't feel I know enough about the concerns of the people who would be involved in Medfield to respond for Medfield on the fly, but I'm pretty sure that you know, I think it's certainly, I see no problem with a sequential approach in which you focus on on Needham first, if they're ready to go. And then, you know, that seems fine. I didn't know if we were sort of foregoing the opportunity to be included, if we went that route. Over.
Thank you for sharing. Hi, Carol.
Hi, thanks so much. I have more of a reflection based on something Tim shared at our Board of Health meeting in Medfield last Tuesday. Through Brenda's work and Steve's commitment, we are looking to update our tobacco regulations, and with all the support from Cheryl and Sarah and new advisories, etc. One of the activities that the substance use prevention grant in Medfield funded was a consultant tobacco compliance check. That funding has ended. So at this time, Medfield will not be having licensee checks, and it came up for alternative funding. So what I appreciate is how these funds that are collected across our towns are actually allocated to operationalize and support and enforce and inspect the permits. So most go, I know, right back into the general fund. So Tim, you saying your fee may be higher because you have a quarterly compliance check initiative. That could be a template for Medfield to follow as a way to continue the work that the town is valuing with the substance underage prevention, and connect it directly to the annual permit fees. So I think that is another benefit of being in this group, that we can take best practices from other people and introduce that in our towns. So thanks for that. And maybe we can talk about that in our next board meeting.
So some communities fund their compliance checks through a use of a revolving fund. The interpretation from Needham, and I'm not an expert, but I do trust them. The interpretation of state finance law is that revolving funds can only be for discretionary things, like choosing to get a vaccine through the town. The town can charge you know, a fee on your behalf to the insurance company and bill the insurance company for the vaccine, and they can put it into a revolving fund. Because if you're looking to sell tobacco, the application is mandatory. Needham's contention is you can't put money into a revolving fund from like a tobacco permit fee. So any money that is collected goes into the general fund. So our costs are higher for
Mm.
that permit because we're trying to reflect the full costs, including extra staff time, sometimes after hours and on overtime. We give historically a gift certificate to the underage buyer or buyers. So we think it's a somewhat accurate reflection, but I don't know if it is. And that's why we really want to do the math.
Thank you.
Thank you. If there are no other questions, we're always available if there are any other questions that, oh no, I'm gonna reshare my screen. And just really quickly, final deliverables, permit fee calculators for all of the municipalities in Charles River Health District, standard operating procedure for calculated utilization, and a brief final report with recommendations, including lever points for fee schedule assessment. All the final deliverables, for the end of this project. And thank you so much for having us. Here are our emails. If you have any questions at all, please feel free to reach out to us. We're always here to help. Thank you so much for having us.
Thank you.
Thank you.
Thank you, Janice and Rebecca. This, clearly from the questions and the engagement, this was helpful and well received. So, Daryl, I see you up. Do you have a question? Is there something we want to cover with Janice before we move on?
No, I don't think so, although
Okay.
I'd say Sherborne will be interested in participating and trying to fill in the numbers. I have a little trepidation about implying that we're coming up with precise numbers. So because that means tracking every permit and charging people according to their need, which would be lovely but hard to manage, I think. So, but I think that's why having a group of information that then we, pick what seems reasonable, I think is what I'm inclined to prefer at the moment, an outcome from.
I think what we're intending in Needham, Daryl, is not you are a category 4, you serve, sushi, or you're category 4, you're serving vulnerable populations, like you're the food service establishment in a assisted living facility, and therefore you're charged this rate. It's more of, how many of you've got 100 food permits or something, say, and I know that's more than Sherburne, but 25 of them are for gas stations that are selling Twinkies and Pepsi. Those are simple. We can do those in 5 minutes. 2 of them are for supermarkets. Those take 4 hours each. What is the rough average? So it won't be exact, and it will definitely have an amount of fudge factor in it, but at least it'll be ballpark. And right now, at least in Needham, it may have been ballpark 10 years ago, but we've, rounded it up, rounded it down, reduced it for COVID, increased it back. And now, I don't know if the numbers bear any resemblance to reality.
Yeah.
I think the other addition is that it is a tool that's available for continuous modification. And so we will, at very least, customize the permit list so that it reflects the community, and then build in those additional columns that have been requested. And so at any point that Sherburne wants to go back and reflect on the admin time and the inspection time, there is opportunity to do so, because we will have also provided a SOP on how to use the calculator.
Yeah, and so adding on to Rebecca's point as well, as long as you have the admin fee in the admin time and the inspection time, if you wanted to change it just to see what the permit fee would look like, you could input it into the calculator and it'll automatically calculate what that fee would look like at the very end of the columns. So if you wanted to adjust for any reason, it would be possible using that calculator.
Thank you.
Great. All right. Well, again, thank you both. It's been great working with you through this, and nice to get the reactions from folks. I'm glad we're moving in the right direction. So great. Thank you.
We'll hop off more. Thanks for having us.
You're welcome to stay, but you may not You may have other things to do, but you're welcome to stay. We're gonna go on and talk about our work plan now. So, right. So I am so I sent you all, along with the BME presentation, I sent you a slide deck last night that goes through the work plan in detail. We talked about this last month, and we talked about doing individual meetings to go through the work plan, but on reflection, I really wanted to try and have this be a collective activity. So I did some work to try and pull the things from the smart sheet and make it a little bit more digestible. I have 24 slides. I have no intention of going through all 24. What I want to do is kind of talk about, I want to highlight a few things. I want to talk about the requirements that we were working within, and then give you the highlights on what each of the objectives that were identified were and what our thought process was in choosing them. And, give you all a chance for questions, certainly. My intent in including all the detail there was that you could have a look at it on your own, look at it continually. And I do intend to use this, at least elements of this slideshow as a regular touch point. And if anybody, as we go through this, says, oh, I really want to spend more time on what all these activities are in this sustainability objective, we can absolutely do that. That's fine. So this is intended to be an overview at this point. I'll run through and I'll take questions, but I'm going to try and keep us running, because we're going to run out of time. It's 10:32 and I want to be respectful of folks' end time. Okay, so with that, now you're all going to get to watch me try and share screen, because no matter what, it never works quite the way I think it's going to. Okay, I think this is it. Okay. Can everybody see my screen? Excellent.
Yeah.
I was on a training this week, and there were folks from all over, and we were all laughing with each other about how silly it is that share screen is never quite easy, but this time it worked. Okay, so here's who we are. And actually, we do have an updated logo. That was one of the things we managed to get done over the end of the fiscal year. And there is some new material. Oh, and Sam can show her hat, because her hat, I think, is branded with the new logo. Our logo includes Sherburne now. It was developed before Sherburne joined us. So, but anyways, that's just a fun thing. So this is familiar to you. I think this is our, it's sort of a org chart logic model squished together. And I did do a couple of little changes to make it flow differently. You'll note that this version is not updated with the FY25 work as of yet. This still shows what our assignments were, what our work was in 24. So I'll be updating that. The staff line is updated on the left-hand side. So we are still seeking a regional public health nurse, and hopefully we'll get that filled. Although the number of vacancies continues to be across the state continues to be high. Got our funding piece. We reflect the voting process. So this really hasn't changed. So that body that you just saw, we receive a grant through, and Needham is our host agency, and we receive a grant from OLRH. And the requirements for the work plan for this year, there are 6 categories of deliverables. And you can see, so there's grant administration. That's, fairly lengthy and includes some of what I call the work there in the gray section, the administrative section on our chart. And then the governance is all related to the IMA. So that will, as we get that passed, that will go away. There are a few, I'll call them modest assignments for the Foundational Public Health Services review. And I know that that's been of interest to folks sort of, well, what are the foundational public health services? How do we use them? And there'll be opportunity through this work to engage in that. And then we had, we were required to have 2 sustainability objectives. And performance standards, we were required to have 3 performance standards objectives. And then we were permitted to have 1 or more elective objectives. We needed to, but those were of our choice and would be added on top. So you'll see how we made the choices as we go forward. And then at the bottom here, you see there are 2 racial equity considerations that were required for all of this work. Well, sorry, not all. For the performance standards and the electives, we needed to make a choice about how to incorporate racial equity consideration in that work. And this was all guided with, strict structure of here, you could do it by using class standards, you could do it by working on workforce diversity. And there were very specific choices of recommended activities that you could undertake. And working through those, it was pretty easy in instances based on all of our meetings, everything that we've talked about. It was pretty easy to identify what the appropriate objectives would be. I just explained a little bit more about the racial equity considerations that we are using for this year. And the first one would be looking to incorporate what they call the class standards. So that's culturally and linguistically appropriate services. And what that means is thinking about, do you have access to translation? So an easy example is the inspections. Do you have access to translation services so that if you're out on an inspection and there is a language difference, is there a way for an inspector to be able to communicate with an establishment? And our first pass at that is that we're gonna have Pocket Talks. We put that in the budget. We're gonna add Pocket Talks. Pocket Talk has been identified as a pretty adequate, I think I'll say, translation device. It is portable. It's I have anecdotal info of different people speaking different languages who said, yeah, it works pretty well. So that is a good step. One of the things that we'll try and do over time, I think, is we want to see if we can quantify how much language difference there is in the region, and is there enough that warrants more investment. Now, you can say, well, we should always have we should always have access to all language translation and on demand if we need it. And I would love that. And with an unlimited budget, certainly that would be great. But given our limited budget, we do need to think about demand and want to make sure that we are providing equitable services and spending the most, the appropriate amount of money, given all of our other priorities, to do that. So, for now, Pocket Talks will continue the conversation. We'll gather some info with you all, and we may come back and say that we ought to do something different with translation. Oops, that was unintentional. And then the other one that we chose is workforce diversity. And the broad topic of workforce diversity, you can see here on the slide, it's about making sure that you're valuing different viewpoints and lived experiences, improving employee satisfaction and retention. One of the things that they suggest under this activity is looking at job postings and job posting processes to make sure that they are blinded. For example, I know Needham, I think when they receive resumes, and Tim, please correct me, I believe that what happens is resumes come in and it's all de-identified, and the first screening is based only on skills and actions. And am I saying that right, Tim?
Yeah, you can see if someone, you don't see the name of the company or the organization. You don't see like a name of a university. You would just see the type of degree. So it really is, are they vaguely in the ballpark of qualified? Do they meet the minimum entrance requirements? And then you'd request personal identifying information. You'd get the full details plus the resume and cover letter.
Got it.
So you can screen out someone who, is just applying for every job that they can find on LinkedIn or something.
Right. And I think, one of the theories on diversity for that is that, since you don't have names, you don't have addresses, you don't have, where they went to school, you just know what they studied, you're eliminating any unconscious bias of saying, oh, well, they went to Yale and so that'll be great, or they went to Dartmouth and I hate Dartmouth. So no, right. And these are kind of silly explanations, but that I think you can take the point of what that is. So that's the intent that we'll use with workforce diversity. Before I move on, anybody have any questions about those? It's kind of unusual, or it's not unusual, it's new that we are required. I think it's a great thing. I think, it's a great opportunity for introducing awareness. But it is a new requirement with our grants. So
Carrie, I just had a question on the first bullet point. I wasn't sure, the Pocket Talk you were discussing, is that a standalone device or is that an app for your phone?
it's a standalone device.
Okay.
And it's updated, and when you purchase it, you get 2 years of data with it, and
Got it.
right, so it can be moved from person to person. And I don't know, Brenda, if the MRC has any Pocket Talks. I know there was talk of doing that in the EP regions, and because they found that it might be helpful with MRC activities, Medical Reserve Corps activities. Yeah.
Right.
Okay.
One of their meetings, but I have one, Steve, if you ever want to look at it. I have one in my office.
All right. Thanks.
Yeah.
And I apologize with my screen sharing. I'm not running 2 monitors, so I can't see everybody. So if you have a question and I'm skipping you, please just shout. Okay, so then grant administration is the first one on the smart sheet, and you can see that there's a healthy long list, and that, it includes things like the monthly meetings for the PHE grantees. So Sam and I regularly participate in those meetings. We hear when we get guidance from folks at Office of Local and Regional Health about what the standard is, what's an allowable cost, things like that. We have to submit some lists. We have to submit quarterly reports, meet the standard of meeting, so on and so forth, right? These are, while it's long, I think, probably half of them require a significant amount of time, and the rest, can be done pretty readily. And what I really like that they put us to for this work plan is asking us to identify who's the primary, who's the secondary, and then give an estimate on when we'll be starting the work, when we'll be finishing it. And, they're also realistic. They include, okay, well, what was the actual and what was the actual start, what was the actual end date, recognizing that things shift. So this will all be updated, and this is what we will be submitting in our quarterly report. So you all will get that, and you'll see where we are in addition to any verbal updates. Governance, as I said, it's the IMA. We are mostly done with the assignments on there. We're just progressing along, getting it approved by all the communities, and then we have to submit the fully executed, and then we'll be finished with that whole section. Foundational public health services, I just wanted to, we've had conversation. How does this work? Where does it get included? So I wanted to provide this graphic from FAB that is, what are the foundational public health services? There are 13, you see 5 areas and 8 capabilities. And currently in Massachusetts, there are advisory groups going through each of these 13 and looking at that national standard and making suggestions for what ought to be added or clarified in the Massachusetts adoption of it. So the participants in the work groups are, experienced folks in each of the different areas. We actually have, let's see, Tim is leading the emergency preparedness and response section. I am assigned to the communications section. I'm working in that group. And there's, a variety of folks from around the state assigned to each of them. Tim, is there anything you want to add about that process that I might help folks?
Oh, I think you covered it.
Okay. So because that process is happening, there are some expectations from Office of Local and Regional Health for shared services arrangements. Once that process is done, there will be some trainings, and Sam and I and Amy and Jen and will be attending the trainings. We don't have a start date because they don't know when that, they haven't given us that start date yet. And then B is so that's me. So your shared services coordinator will facilitate discussions with your shared services arrangement about foundational public health, foundational area and capability. So what do we have? Basically what it is where are our strengths among the communities, and where do we have expertise in the areas? And then there'll be a shared services level review. So we'll be gathering some info for it, and then we're talking about, well, what does that look like? What is foundational public health services capacity look like in this 4 community grouping? And then I guess there's going to be a review document that we have to, we will work with the advisory board and all the towns to complete. And it's due, according to OLRH right now, it's due February 1st, but it doesn't exist yet. So there will be, we'll need to be having some continued conversations about this. And I until the Massachusetts recommendations are out, I don't have anything more than that graphic for you. And there's a process happening, and then we'll get to tag in on that and work it through ourselves. Questions on that? No, good. Okay. Then sustainability were the next objectives, and sustainability is about the sustainability of the organization, about shared services. So we're asking, its long-term viability of how does this group function? And the 2 that we are working on this year are establishing an inventory system for the different things that we purchase. And then also a strategic planning activity. And you'll recall I said the strategic planning activity you won't see in our budget. We're able to use funds from the contact tracing and case investigation dollars to support that. So it's a nice benefit. So Tim and I have already asked him for some help. I have to get a RFQ written up for that strategic planning piece. Once Tim has helped me, I'll share it with you all, see if there's any feedback, see if I'm missing anything, and then we'll get it out there and get that rolling. So I'm excited about that. I think that some of the things we talked about earlier this morning about reporting and what's the information that we need and how do we talk about this, I think that fits nicely with the strategic planning need. So and then so for each of these objectives we have a number of different activities, And Sam is going to be taking the lead on the inventory management process. She's already been amassing things and keeping track, and we've had some talks about what's the best way to manage the inventory. So you'll hear more about that. And strategic planning, we identified the activities that we would need to have, and we'll report in on those dates to OLRH as we progress. Then we had 3 performance standards. Oh, Carol?
In regard to sustainability, and I lowered my volume. Government, state level budget. I would expect a part of our advocacy would be to continue to support our state reps and encourage that these funds be included in the Commonwealth's operating budget. Is that?
So a great point, not part of our work plan and assignments from DPH to do so. Certainly I know Mass Health Officers Association and Mass Public Health Association are actively working on that, and there are opportunities for advocating with them through them.
Yep.
I can't because of my funding, I can't, but if any of you said that you wanted to do such a thing, I would think that would be a great idea, and I would suggest that you get in touch with MHOA for how maybe to go about that.
So Tim is here, and I feel an important thing for me, and I can share it, Steve's here, with our Board of Health, is there may be talking points MHOA has about this work, and I would love to have those, and we can follow up later, but thank you, because
if any of you ask me to procure, to get information for you, sure, I can go about finding out about that. Tim, are we covering this adequately?
Sorry, I had to step away for 1 sec. I didn't catch the full context.
That's fine.
Were you advocating?
Carol was asking about, advocating for continued funding from the legislature for supporting these activities. And I said, it can't be OLRH can't ask us, won't ask us. That's not something that we can do as part of our work plan. But there are avenues. And if somebody, when somebody asks me, I can say, yeah, MHOA and MPHA, I know are very active and engaged in that. And there's ways for individuals to find information and figure out how to get involved.
talking points, Tim, because I've worked with Denise Garlick as Medfield rep, and then through Needham, she keeps us abreast. She'll be leaving. If MHOA has talking points about this funding, which is,
So the
the
budget
first.
is what
Yep.
it is. It's a slight reduction on what was requested. The sort of Coalition for Local Public Health, which is MPHA, MHOA, Mass Environmental Health, Mass Association of Public Health Nurses, Mass Association of Health Boards, et cetera, decided not to fight that hard against that because there's a lot of ARPA money still, and the biggest priority is passing SAFE 2.0. SAFE 2.0 was included as an amendment to the Senate's Economic Development Bill, which is going into conference committee. The hope is that it will be passed through conference committee and become part of the final legislation. The Economic Development Bill is kind of too big to fail, so it's going to pass. The question is just what is added to it or what is stripped off of it. The House did not pass SAFE in part because of very sort of bitter personal political fighting. But the Senate did. So the hope is that it will get passed and will be passed this session. MMA actually came out in support of it. The state agreed to a small tweak in the language, state public health department. and MMA is supporting the bill now. Last time they worked with Governor Baker to kill the bill. So that's a positive. But
So
once we
the
get safe, I
safe
think,
is
yeah.
the words. The
Yep.
budget is more what I'm interested. So how can I get just the words about supporting the money that supports safe? And I can ask you about this later,
Yeah, but that's already sailed for this year. So
but
what's that?
next year, because Carrie was talking
Sure.
about sustainability. That's
Yep.
all.
And we can definitely do that, but that would be for, next March, next April. So we have time to get those. We can definitely do that.
Thank you.
Thanks, Carol, because yes, so this is a very, this is focused on what's the work we're funded to do and what are the things that we have to do for OLRH. And yet there is also larger sustainability questions, both for, how does this kind of program continue? And that doesn't even get into the sustainability issues of climate change and the like. So a few different ways to think about that word. Okay. Some reason, there we go. So now performance standards. Sorry, I can't see. Having trouble with my screens. So the performance standards are required, and they are intent upon improving the ability of all communities to meet the performance standards set out. So these are standards that were, let's see, they were presented to the Public Health Council in October of last year. They're available on the website. They're standards for community performance, and then there are some workforce requirements. And the intent from OLRH is that these are measurables of how are we doing and as I've said, increasing that percentage. So I think right now, our 4 community group, we are at 85% on meeting the performance standards. And our work is, how do we make us up to 100? And what does that look like? And OLRH is intent on improving that in every shared service arrangement. And because they think that that the assumption is that improves service delivery. So what we're doing is, oops, I apologize, I'm touchy on the buttons. So 3 things. We're gonna enhance staff capacity to meet and enforce regulations in alignment with performance standards. So that is looking at the details of the performance standards, seeing where there's opportunity to improve it. Is it that it was a misunderstanding in the way the capacity assessment was completed? Is it a need for additional staff person that we could help you identify? Sometimes communities identified that and say, oh, there's no staff working on that. So we'll look in detail with each community at what the opportunities are. And then I put in parentheses here, workforce diversity, because that's the racial equity consideration that we'll be using for that particular one. So again, thinking about, it's about hiring folks, and we'll talk about, are there ways to change the hiring practices? Do you want to do anything to improve those? Then the second one is about infectious disease. Once we have a public health nurse, it's about working with all the communities to improve that, in establish and improve that capacity. And the third one is training, right? So we'll do some needs assessment. It sounds so formal, but let's figure out, well, where are the gaps? Are there, like Amy wants to get her soil evaluator, so we'll do that. We'll talk about what the other communities' needs are. Is there some additional training, and can we support that with funds? Can we help you meet those priorities? And then our elective is tied to that. Again, it's about what are all the different staff needs in the communities to meet the workforce standards, the performance standards, and it's our job to help you through on all of that. So this was a little bit of a whirlwind tour, but it gives you the range of what we are working on this year and gives you access to all of the specific activities that we need to complete and, be accountable to you and the Office of Local Regional Health for. Any questions yet? Besides, can you put this on the agenda for next month, or please don't ever give us this level of detail again, or anything in between?
I just have a hard stop. I gotta drop off at 11, but I thank you for this, and I think I gotta digest, but it's really
Yeah.
informative. Thank you.
Okay, thanks. Then, and if I don't see anything else, there are two other pieces. One is we need a location, and it's Dover's turn to host in August. So I want to just highlight that. Jason will be in touch to make sure we can book a room and figure out what the IT capacity is, and that will share that info. And then the other piece is that my annual review is coming up. I was hired on I started on July 24th, and Tim is going to be reaching out to folks and, asking for feedback to inform that review process. And, that's per the IMA that we are almost adopting. So if you could just have this in mind, if there's anything that you want to share with him about performance, about needs or questions, you'll have that opportunity, and I hope everybody will be able to take advantage of it. And that's all I have. And it is 11:01. So unless I see a question. Oh, Carol's got her hand up. Sorry.
Just a quick question. Can you back up your slide to the one before this? Thank you.
No, this one. This one, right. And you have this, and I can share it again. Here's the caveat. This was based on FY24. We didn't have all of the other deliverables, right? So we might be massaging the language a little bit. But it's that, that's still what we're trying to do. And then this, how does it work? That is still accurate. Okay. All right. So then I think at 11:03, I'll say thank you all. And I look forward to seeing you in August, and I hope everybody stays cool and gets some fun summer stuff between now and August. Okay.
Good to see you, everyone.
Thank you all.